few scabbies, but that will fall off with time.
Okay.
His exam was pretty much, I mean, he looks great. I don't get any neck pain when I move his head around. Don't chew on that. His gait looks normal. So I think my recommendation will be, and I have this typed up here.
Oh, okay, thank you.
So 2 more weeks of strict rest, okay?
Okay.
And then after 2 weeks, you can start to increase his activity back to normal.
Okay.
You can finish off the prednisone.
All right, and what about the
tramadol? I would probably wean off the tramadol and the gabapentin because I don't think he's painful. So you can start to you can stop one.
Oh, like maybe do once a day instead of twice a day?
You can do once a day for twice a day, or you can stop one, you can continue the other for a few days and then stop the other one. But I think he looks really good.
So taper that off maybe over the next week?
Yeah, sure.
Okay.
And then he can probably get neutered after he's rested for
2 weeks. Okay, and then when do we come back here next? Or
as needed.
As needed.
Yeah.
Oh, okay. And then in terms of getting him adopted, what do I need to prepare adopters for?
I think he does have some lower back pain that is much better.
And is that the compressed discs back here?
Yeah, so he does have evidence of IVDD or intervertebral disc disease. And so that just means, his discs degenerate and, that's just something to watch for in the future. So there's not much you can do for the degeneration, but you can certainly, keep him at a trim weight. So skinnier rather than
Do you think he needs to lose a little?
He can lose a little bit.
Okay, because I can feel his waist.
He's not terrible. But
he's about average weight.
I don't think, I would get him any fatter. So typically I recommend, good weight control. Try to discourage too much. He's falling asleep.
Is he? Are you tired, Leo?
Too much jumping or, on and off of furniture, stuff like that. It's mostly lifestyle changes. So.
And as far as so whoever adopts him, they should keep him from getting up on high furniture and stuff.
Yeah.
Leo, I'm just trying to run a video here, so if someone adopts you, they can hear what the doctor has to say.
And and it's not always a situation where it might not ever be a problem ever again. But I think it's certainly something that we know he's had this condition, and so we just have to keep an eye on and just be cognizant of it.
Okay, so and if he ever has problems with his compression in his lower back, what would be?
Go ahead.
What would be? I just need to prepare adopters. What can they expect? Do they need to go to a neurologist?
I think certainly it's something that if they're worried, they can start with their primary
physician.
Yeah.
And, okay.
If it's a situation where they say maybe we need to just have a neurologic evaluation, they can do that. Not all disc problems will end up with surgery.
Okay.
But, some of them can get better with medications and rest. I think every situation is different.
Because we had another dog that was adopted a few years ago that turned out had compression in her lower back. And her lady who adopted her, I think, takes her to physical therapy.
Yeah, you can certainly do that. I mean, something like acupuncture.
Oh, yeah, acupuncture.
Yeah, absolutely.
Okay.
Yeah.
All right, and then when can he wear a collar? Wait 2 weeks?
Yeah, after 4 to 6 weeks. So after post-surgery.
We'll wait 2 more weeks.
2 to 3 more weeks, yeah.
I'm not looking to put a collar on him, but I'm just saying, if he gets adopted, I don't want him out in the world with no ID on.
Yeah.
Or I could do a harness.
I would do a harness.
A harness. Would you like a harness, Leo? Okay. Oh, and then how old do you think could you even guess his age? Is there any way to guess?
No.
There's no way to guess.
That's a hard question.
I know.
That's a hard question.
Do you think it would be okay for me to bathe him at this
You can
point?
have a bath. Yeah, absolutely.
And I probably can't take him to a groomer though. Not a grooming table.
I would wait until 2 more weeks because
All
I
right.
have to put a leash on him.
Yeah,
Like
I think
that.
I'm just gonna bathe him at home and try and shave his ears.
Yeah.
Okay. All right. So
This is great.
anything else? He's in good shape.
Yeah, I think
Leo.
I didn't put down any rechecks. Really, just as needed. If you're worried, you can always let us know. But he looks really good. I'm happy with how.
Okay, and then his MRI records or X-rays and stuff, that's all on record here.
Yeah.
So if
they
someone
want
adopts
copies.
him,
Yeah.
they can call here and have it.
Yeah.
Okay. All right. Thank you, Dr. Ty.
No problem. Bye, Leo. It's
Leo.
good to see you.
Okay, Leo.
Say bye.
Say thank you, Dr. Ty.
Oh, you're such a sweet
Oh,
boy.
he's a good puppy. Good boy, Leo. Okay. That was good news.